Hi everyone. I want to welcome you virtually to New York City. I am Delma Palma, a community design architect at the New York City Housing Authority. NYCHA is the largest housing authority in North America. We have over 2,400 acres across the city of New York. We're almost in every community district of the 5 boroughs of New York City. And of that portfolio of land, about 70% of it is open space through what is seen as lawns, sports courts, seating areas, and surface parking lots. We house over 500,000 New Yorkers, and our population is larger than actually a lot of cities in the U.S., including the cities of Minneapolis, Salt Lake City, and Miami. We are the largest landlord in New York City. As I said, we house 500,000 New Yorkers, and of those, a good percentage of them are children, and about 25% of them are seniors, a population that is also continuously increasing. And most of our residents are people of color. NYCHA residents do exhibit exacerbated rates of asthma, diabetes, hypertension, smoking, depression, in comparison to other types of New Yorkers. And we know this is due to several different aspects and social determinants of health. In terms of what the buildings actually look like, we have what we call developments or campuses, over 300 of those across the city with over 2,500 residential buildings and almost 170,000 actual individual apartment buildings. So these can be seen as different building typologies depending on when they were constructed. We have several pre-war typology buildings, these 6-story walk-up buildings that blend into the rest of the urban fabric pretty well. And then we transition into the early towers in the park typology. This is when you start to see a lot more of this open space surrounding the building. Later in the towers in the park typology, they start to get taller. So you start to see fewer low to mid-rise, more high-rise development. And then later on, what we are calling our scattered site typology, which is a combination of these towers, but also smaller infill buildings. Primarily in the 80s and 90s, the design philosophy of CPTED, crime prevention through environmental design, really highlighted the idea that the ownership of space is what made it secure. And so in the way that was interpreted and then implemented at NYCHA was to install this steel bar fencing delineating what space was accessible to people and what space was not, which was typically all of the green space. But what ended up happening was that it really created this ambiguity of spaces and a lack of ownership in a lot of cases. And so the Connected Communities Initiative is focused on, first of all, evaluating these spaces and looking at what spaces make sense for activation, for redesign, and working with community members and different partner organizations to help improve and activate those spaces through the participatory design process. The Connected Communities Initiative is an initiative to help better connect our residents to the rest of New York City through the design of the public realm. So when focusing on the design and activation of space, the Connected Communities Initiative wants to understand what the community needs are. And across the board, some trends we saw were issues of public health, public safety, and social resilience, particularly to climate adaptation. So to go into a little bit about how the Connected Communities Initiative was developed, it started with a lot of research and evaluation of what opportunities we were talking about, what partners would engage with us, and what resources were out there to actually implement. And so we did that for quite a while, also along with different city agencies, because We know that NYCHA interacts spatially with a lot of different departments in the city of New York, such as the Department of Transportation, the Parks Department, all different agencies with their own operating and capital budgets that affect the public realm. So we had several interagency charrettes to talk through the ideas of connected communities and how they could be implemented in the future and what types of processes the different city agencies were going through themselves that could help further the connected communities goals. We knew that NYCHA could not do this alone. We needed the help and support of our city agencies, but also nonprofit groups involved in community outreach and design and construction in the public realm, as well as private foundations and private development teams that are working with NYCHA's real estate initiatives on building and preserving affordable housing. One of our big milestones was the release of the Connected Communities Guidebook, which we did in partnership with the Department of City Planning. And it is the collection of our urban design guidelines, but also our guidelines for community outreach to public housing communities. And our community engagement principles are developed from years of outreach that NYCHA has done to public housing communities, but also the projects that we've been implementing and talking to different NYCHA resident groups to see what they think is at the core of truly inclusive and transparent engagement. And implementing these principles is key to being able to successfully activate a space.
An important component to connected communities is community activation of urban design solutions. This work is supported by NYCHA's Department of Health Initiatives, which works across systems to build health through partnership and engagement. Health Initiatives fosters internal and external collaboration to connect residents to preventive health resources, such as discounted memberships to New York City's Bike Share program, to help create healthier indoor environments, including ongoing work to strengthen adherence to NYCHA's smoke-free housing policy, and to cultivate and support resident leadership in health. During the pandemic, Health Initiatives has also led strategic partnership with the New York City Health Department and the city's public hospital system to promote the availability of COVID-19 testing and vaccination and critical access to public health information, emergency food, and other resources. Health Initiatives' work is built on the foundational belief that many NYCHA residents serve in a civic leadership or employment context as community health workers, health leaders who are ideally positioned to lead the charge towards better health outcomes. Looking across NYCHA's health activation initiatives, examples of community health workers are varied and include a resident employed by NYCHA to work across developments and across generations to promote awareness of the benefits of reducing exposure to secondhand smoke. Also, a resident trained to lead fitness classes through the New York City Parks Department's Shape Up program, and residents participating in a 3-course job training program led by a New York City community college, which leads towards employment as a community health worker that can provide health coaching and other support to community members.
We are a national nonprofit organization that has worked since 1972 to connect land and people. We've done this largely through private-public partnerships. We do a lot of conservation work, but I'll talk about our urban work where we create parks. And our method is to work closely with communities to realize their visions. We don't come with top-down solutions. We come with data, certainly, and we come with ideas, but we want to realize community goals. But then we work with public-private partnerships, and that's for a few reasons. One, we believe the nonprofit sector, it's a little leaner and meaner, and also more innovative and possibly more flexible than the public sector. But the public sector is where you really will scale up solutions, and there's good reasons for both those characteristics. The public sector has to answer to broader constituency, and there are a lot of rules and procedures in place to make sure everything's fair, and that can slow them down. But once the public sector gets engaged, you can have big solutions. And we've worked with the city to create over 230 parks and playgrounds, protected over 70 community gardens, and brought over 5 million people within a 10-minute walk of an outdoor space just in New York City. One example is converting spaces like this vacant, barren schoolyard in middle school 354 at Crown Heights, Brooklyn, to a beautiful, vibrant area. Part of our agreement with the City of New York is to, we'll do some private fundraising for this. There's public dollars behind this as well. Of course, we need the cooperation of agencies, but also schools have agreed to open these facilities to the public after school hours and on weekends. And so that's the kind of thing we do. And we've done at scale. We've done 214 of those projects because of our partnership. NYCHA as well in New York City has over 300 campuses. If we could put a fitness zone in each one of those, that would be a really tremendous benefit to the community in activating open spaces that might be underused.
In 2018, NYCHA and partners launched work to create the nation's first large-scale adult fitness equipment installation, or fitness zone. The partners focused their efforts on Carver Houses, a 13-building NYCHA development that is home to approximately 2,600 residents. Carver Houses is situated in the East Harlem neighborhood of New York City. Over the years, East Harlem has been highlighted in health equity analyses comparing how adjacent but distinct neighborhoods or zip codes can experience very different life expectancy outcomes. Stretching over 3 large city blocks over a span of 7 vertical streets and adjacent and proximate to a high concentration of other NYCHA developments, the Carver Houses community is led by a resident association that represents the interests of residents. Over the course of 5 community meetings, the resident association formed decisions such as the location of the fitness zone, the type of equipment it contained, and additional amenities such as seating. The location that was selected was an underutilized fenced-in grassy area adjacent to the development's Senior Services Center.
This project was before I came into presidency, but once I got involved, I pushed it through with the help of the Trust for Public Land and Mount Sinai and NYCHA. We had an excellent ribbon cutting in January of that 2020 before the pandemic hit, where everyone came out. Some of the residents came out in the cold and supported it and worked out on the equipment. The equipment was utilized during the pandemic. Me and my board members urged NYCHA to power wash the equipment. We came and hand sanitized stuff. We gave residents masks and encouraged them to come out and to work out. It's a stress reliever. As you can see, some come out now from the hospital. Some of the residents come out even in regular clothes and work out. So it's not even about being intense and wearing gym clothes. You come out casual fit and just work out and just release your mind. It takes you other places. We're encouraging others that have been speaking to me to partner with us and teach yoga, Zumba, and just fitness, period, because it's needed at this time right now during the pandemic and also in life, period. So that's what we're doing right now in our development.
Hi, my name is Amber. I'm here working out on my lunch break. I work at Mount Sinai, and this right here is really beautiful because I'm taking my time out on my lunch break to work out here, which I don't really have that much time. So it being nearby my job, being out here in the open, I'm thoroughly enjoying it, and I feel better about getting healthy. So thank you so much for making this. I hope to see plenty more all around. It's not only myself, but everybody in the community has access to it. So keep doing what you're doing, and thank you.
When Trust for Public Land came into our general meetings in the center and engaged the residents, they showed them the plan, the equipment. The residents had a hand in picking the equipment and the color scheme. So they was excited to be a part of the building of the fitness zone. Them walking by, they're amazed every day. And the children come here. You have our seniors who partake in it, young adults, teenagers, my children, me as well. So it came forth a great time. I would like to thank the Trust for Public Land, Mount Sinai, and NYCHA again for putting this in development. I can't wait to see what other developments get this opportunity to have it in their development. And hopefully I get to go over there and speak and see the excitement in those residents' faces.
Welcome, everyone. I'm Tara Nelson, and I'm the Research and Projects Officer here at Future of London. We're really delighted that you've joined us today for our first ever international virtual field trip, where we'll be visiting the New York City Housing Authority's Connected Communities program. Just to avoid any confusion, I'm going to be referring to the New York City Housing Authority as NYCHA from now on, which is their acronym. So this is the second event in our Healthy Neighborhoods Working Together program, and the program aims to find effective solutions to collaboration challenges between the health and built environment sectors. I'd just like to say a huge thanks to our brilliant sponsors, Montague Evans, Mount Anvil, and Pollard Thomas Edwards Architects, who have made this program possible. And of course, I'd like to say a huge thank you to the team at NYCHA and their partner, the Trust for Public Land, for working with us on this event. I'm going to tell you a bit more about the program shortly, but before I do, just a little bit of housekeeping. So we are live streaming today's session on YouTube, and it's going to be shortly available afterwards on our website and our YouTube channel. And we'd really like to make this event as interactive as possible. So we've deliberately limited the numbers of participants today to really try and encourage a two-way discussion and to give you all the opportunity to contribute your own experience and insight. As I mentioned, please do change your screen name label if you haven't already to your full name and organization so everyone can know who you are. And I really encourage you to add your thoughts and reflections in the chat as we go through the presentation and discussion. During the presentation, please do keep yourself on mute. And if you have any questions that come to mind during that for the panel, please just pop them into the chat function. When we do get to the discussion and Q&A section, please raise your virtual Zoom hand and we'll come to you. And we do want to encourage people to keep their cameras on and ask questions themselves to our panelists, so keep that in mind. And finally, we're going to be tweeting about this event on our Twitter using the hashtag Healthy Places, so you can follow that online too. So the format for today is going to be a quick outline from me, and then the presentation from the NYCHA and the Trust for Public Land before turning over to you all for an interactive discussion that's going to give us the opportunity to learn from our colleagues across the pond. And this is going to be led by our Chief Executive, Nicola Mathers. After the main event, we are going to hold 2 rooms for networking, and we really know that a lot of you are missing out on getting together over nibbles to chat. So of course, while we can't provide snacks, we really hope that you will join us for a more informal chat, so you can start to make connections to support your work and give you a chance to speak to those people that you're just not bumping into at the moment. So now for just a small background on the Healthy Neighborhoods program. Our focus on this theme really came from a shared understanding that we all have a role to play in tackling health inequalities and making our cities more resilient and healthy places. The pandemic's really served to shine a light on the huge health inequalities that we see at local, national, as well as global levels. And we think that in the built environment, perhaps we don't always know the best way to work with health colleagues, and there's a sense that we don't understand each other's way of working or how to access the right people for the right projects at the right time. So what this program seeks to do is highlight the barriers to effective collaboration with the health sector and provide practical and inspirational ways to overcome these. So virtual working patterns have really afforded us a unique opportunity to link up and learn from others outside of our normal circles. So of course, London and New York are global cities, and we're connected in many ways, and we're so similar with our rich and diverse populations, as well as the huge range of cultural and economic opportunities. And of course, as major cities, we both face similar urban issues, but we also both lead as global examples for innovative policy and programs like Connected Communities. So by now, I really hope you've all had the opportunity to watch the video we sent you as a way of introduction to NYCHA and the Connected Communities program. And I'm now going to hand over to our speakers, who I'm going to ask to briefly introduce themselves. So first up, we have Delma Palma, who's the community architect with NYCHA, and then we'll hear from Andrea, who's the Director of Health Initiatives at NYCHA. And finally, we have Carter Strickland, who's the New York State Director at the Trust for Public Land. So now over to our panelists.
Hello. Okay. Thank you, Tara. So I also want to briefly introduce other NYCHA folks who are on this call too, Videhi and Maggie, who'll be joining us for the networking and will gladly answer questions about what we'll be talking about today. So as mentioned, I'm Delma Palma. I'm a community design architect and also urban planner at the New York City Housing Authority, or NYCHA as we like to call it. And so I've been leading this program for about 4 years now. And it's really focused on around the design of the public realm and innovating around that. So if we can move to the next slide. I'll touch a little bit on this stuff. I know it was in the video, but just to get everybody prepped for the discussion, a few points, and then we'll dive into a little bit more about the roles that each of our organizations has played in this very great partnership. And some of the more inner workings of the initiative as well that we did not necessarily touch upon in the video. So briefly, the New York City Housing Authority covers about 2,400 acres of land across New York City. So it's very, very large in comparison to a lot of other US cities. It's actually bigger because we house over 500,000 people in a lot of the different districts of New York City. So we're also very spread out and well connected to transit, parks, and the different amenities that you find in New York. Next slide. And then the building typologies changed throughout the construction period of the Housing Authority. So we went from even the kind of typical, what folks think of when they think of New York, the walk-up apartment building, to this, what we're calling early towers in the park. You start to see kind of the disorientation from the grid that is typical of New York, a lot more open space, but still relatively low rise, low to mid rise buildings that later on started to turn into high rise apartment buildings. And so you see both of all of these typologies, and then later on a sort of mixture of both, and then some that are starting to just be infill sites within the blocks of New York City. Next slide. This just shows an axonometric aerial view of what those types of buildings look like within the urban fabric of New York. Next slide. And then some photography of the current situation. So you start to see the character. I know it's a virtual field trip, but hopefully you can start to understand the character of these spaces and what they feel like, whether they're high rise, as you see in the lower left-hand side, or more mid-rise in the upper left-hand side. And so they have the character, a lot of red brick buildings, a lot of steel bar fencing, which I covered sort of the philosophical reason for that in the video, but very standard character across the portfolio. Next slide. So the Connected Communities Initiative is the urban design approach to help activate and improve the connections with the NYCHA community and the surrounding neighborhoods of New York City. And so we're doing this through different policy developments, what we're calling participatory design, and engaging in partnerships with many different entities. Next slide. This is just to briefly touch on, like I mentioned, the internal workings of how the initiative was actually developed. We thought it was really important to include our many partners from the beginning, since we knew this was going to be an initiative that involved working with nonprofits, other public city agencies, as well as private foundations or private development teams. And next slide. This dives a little bit into our strategic plan and how we, after doing a lot of research and investigation on what we wanted to pursue and what types of partnerships and how this would work with the communities that we house, we developed a strategic plan for how to implement it, whether that was the changing of the policies or the relationships we had to build or the resources we had to gather to actually build and construct some of these spaces. So here you see a smattering of those partners we involved in that strategic planning process. Next slide. And some of the other folks like the Trust for Public Land that we've been able to implement projects with. Next slide. And I think this link is going to get dropped in the chat, but this was a huge milestone for us, which was the creation of the Connected Communities Guidebook. This was a collaboration between New York's Department of City Planning and NYCHA. So it was the first collaboration of this kind to actually create a policy document that outlined what our urban design priorities were, particularly since the urban fabric of NYCHA looks so different than the rest of New York City. So we did this together through, I think it took about 1.5 years of research, but also different discussions with our partners, with the community residents to figure out what the ways of engaging public housing communities too would be most effective, because there is a chapter that's specifically about community outreach, as well as the public realm and building design. Next slide. Yeah, so here you see the breakdown. It's a little bit of history, a core focus on community engagement, design guidelines for open space, but then for new construction and rehabilitation as well, as NYCHA moves ahead in many real estate initiatives for how to build more and preserve its affordable housing. Next slide. And then this is a current project that is very related, and I thought I would just highlight briefly for how we're sort of scaling this across the portfolio. We just underwent during COVID an open space master planning process for how do we re-envision these spaces to look like to be a part of the 21st century, given the changing demographics. These spaces now house totally different communities than they did when they were built. And we know the demographics are going to continue to change, and so have the best practices in urban design and planning. And so this was the first step in really understanding that and analyzing that and being able to implement appropriately. Next slide. We wanted to highlight that we think we're doing a pretty good job so far. Thanks to all of our different partners. We've also been doing a lot of learning, but we appreciate any international collaboration that's possible, because we really think that there are a lot of strong ideas out there to share and collaborate on. So next slide. I'm going to turn it over to my colleague, Andrea Mata.
Hi, everyone. Great to be with you today. My name is Andrea Mata, and I lead NYCHA's Health Initiatives Department. Really excited to be with you in person. We were recording the video, which I hope folks had a chance to see. And, it was wonderful to share the information that way, but it felt a little strange doing it and not knowing who we were talking to. So just want to speak a little bit about the work that we've done on the program and partnership side to complement the urban design work that has really been the centerpiece of Connected Communities. And so we can go to the next slide. The Health Initiatives team really works at the intersection of public housing and public health. And the reason for our work, sort of the driving force, a lot of it has to do with the inequities and health equity gaps that we see across New York City. So we're able to look at data from a number of sources, and what we see on this bar chart is from an annual survey that our city's health department does. It's called the Community Health Survey, and they're able to compare responses to the survey for public housing residents and other New York City residents, and we consistently see gaps and inequities across a number of different areas, but two areas that consistently stand out, I'm sorry, I've got some background noise, are asthma and diabetes. There have also been a number of journal articles of researchers taking a look at these health gaps and publishing reports, the most recent of which looked at hospitalizations and took a look at avoidable hospitalizations. and some of the gaps that we see there as well. We can go to the next slide, please. So the work that my team does is, again, to really build health working across systems through partnership and engagement. That's a lot of collaboration. Sometimes it's internal collaboration across NYCHA's, complex bureaucracy, a lot of our operations teams, as well as the capital teams that Delma represents today. And we really seek to activate strategies that are consistently connecting our residents to preventive health resources. So from a program perspective, that could be something like physical programs that are promoting physical activity. And we see here the city's bike share program, we call it City Bike. That's another example of work that we're able to proactively connect residents to, but there's also a lot of work around mental health. And we are obviously seeking to activate partnership strategies that are helping to create healthier indoor environments. That's not so much the focus of our discussion today, but lots and lots of work at NYCHA in that regard. And really consistently across our work to make sure that we are always positioning public housing residents as the public health leaders that are helping to lead this work. We know that we have many resident leaders across the city who have been working for decades essentially as health leaders, and we just want to consistently build the capacity and support those leaders to help shine and take us through the important work that we have to do. Next slide, please. So just a quick look at some of our initiatives to give you a little bit of a flavor of what community health leadership and health partnership looks like to us. We do have a smoke-free policy. It's a long-term process to implement and really make our buildings truly smoke-free, but that is work that my team has led over the years. Obviously, the fitness zone work that we're going to hear more about from our amazing partner, the Trust for Public Land, shortly. Other work to promote mental health and wellness. We have a significantly sized urban agriculture partnership that we call Farms at NYCHA. And then, other work to focus in on newborns and families that have a new child to make sure that we're doing what we need to do to make those units safe and support those families. That's one of our newer projects. And lots of work, again, to build the capacity of our residents as health leaders, both in a civic regard and also in an employment regard, in terms of like positioning them to be community health workers. I don't know if that's a term that translates for you all, so maybe we can just talk about that more in the discussion. Next slide, please. I'll try to speed up a little, and I'm getting ready to kick it over to our partner, Carter. So Carter Houses is a development. I think you probably heard in the video. It's located in Manhattan. We call that one of our 5 boroughs, what many people regard as the heart of New York City, and specifically in the neighborhood of East Harlem, which is a neighborhood that over the years has really been focused as, historically a lower income neighborhood adjacent to a very affluent, higher income neighborhood, the Upper East Side. And there have been many comparisons and analyses of the differential in health outcomes, specifically looking at things like mortality across neighborhoods and what we call zip codes, which is a geographic unit of 2 neighborhoods that are immediately adjacent. So we can go to the next slide. Carver Houses is a development, and if we didn't make it clear earlier on, developments are clusters of buildings. So here we see Carver. It's a 13 residential building development, lots of green space around it, and very much, within the city grid. It covers 3 sort of super blocks, but also across 7 city blocks. So really quite a large span. And the space that we identified to build this fitness zone is in that middle section. So really nice that it's accessible to residents, really across both sides of the development. Sometimes our developments are so large that if we put an asset or a resource on one side, it's not always fully activated or used by residents in other part of the development. But that is what we were able to do at Carver. And we'll go to the next slide. I think this is my last. Just to see that the space, it is a green space that existed, but it was really underutilized. I think that we heard, not that this isn't an important use for the dog lovers out there, but that it was a space that people brought their dogs for them to kind of roam free. And there are other spaces at Carver like that, but it was so wonderfully situated immediately adjacent to a senior services center, so a place where older residents are visiting on a daily basis or regular basis. At least they were prior to the pandemic, and we're happy to be able to be reopening our senior centers across the city. And you see the before and after pictures here. So I am going to let our colleague and friend Carver Strickland tell the story a little bit more of how we went in and worked with residents to design and partners to secure funding to support this amazing initiative.
Thank you, Andrea. You can go to the next slide, please. And good afternoon, everyone. Pleased to be able to share our experience here and brainstorm a little bit. So the Trust for Public Land, I guess I should start. I recognized a little bit late that our name might throw you off. We are a private nonprofit. We, unlike the National Trust, we don't have a government mandate, although we work very closely in partnership. We also we're not a bank trust. We don't sit on a pile of money, which sometimes does lead to confusion among community partners. We are supported by philanthropy. And, since the early 70s, we've been a conservation organization that always started with a focus on people and started in shortly thereafter with a focus on urban areas. So we think we're very unique in that sense. Our mission is to create parks and protect land for people to ensure healthy, livable communities for generations to come. And it sounds like a natural fit to NYCHA, but it took us a long time to sort of find each other as partners. One reason we do know, and many of you, of course, know that the environmental factors of health, both mental and physical, are very critical. In fact, it's often said, and the data show that one zip code, again, that geographic unit, is the biggest factor for determining health outcomes, the social determinants of health. It's one reason why we measure, not the only reason, but one reason we measure how many people live within a 10-minute walk to a park. We rank the top 100 cities. We make that data available to 14,000 what are called urban areas in the U.S. on our ParkServe database as a way to encourage cities to get to 100%, basically, because we know and data show that 10-minute walk is about half a mile. That's how far people are going to walk to get outside and use a park and become active, meet our Centers for Disease Control guidelines for health, which are about 150 minutes of activity per week. Our method is working closely with communities and bridging that gap between communities and public entities like NYCHA, and in what we call public-private partnerships. We brought that model to New York City, over 40 years ago, and we've created 230 parks and playgrounds. I'll talk about some of them, but it's been really a wonderful run. You can go to the next slide. And I want to say that we brought 5 million people within a 10-minute walk, so it's a good success. This is kind of our flagship program. What it does, and it shows the sort of power of our partnership model. It's very hard to buy and create park space and expensive, but so we have looked around for land that's already publicly owned and not well designed and therefore underutilized. And you can see here, this is a project we just did. It's one of 214 green schoolyards we've done around the city under a memorandum of agreement that has evolved over time, but it's been over 20 years in effect. And you can see on the right is the before shot, right? This is a middle school in Crown Heights, Brooklyn, heavily minority area with poor health outcomes, among many other things. It's not an attractive place to play for school kids. And you can see the 20-foot fence there. So that has kept the public out even from this open space, which is not a great outcome. We do two things. We raise private money. We also raise a lot of public money from various sources. And that's one thing that a nonprofit can do a little bit easier than a city agency, to build what you see on the left in the after shot, which is a very attractive, brightly colored, wonderful play space. We do use artificial turf in that field in the middle because it's durable and attractive, but you'll see that it also has some special powers. A lot of trees, when those grow up, they'll provide shade. And critically, that fence that you see around there does stay in place. But when we get involved, it becomes open to the public after school hours, on the weekends, all summer. So it is a community asset and community park. And, that schools are interested in this because they get a beautiful spot, but also it really strengthens the ties between the school and the community. in our system in New York, elementary and middle schools, some high schools really draw from the immediate area. So the kids that are here and benefiting from this during school hours are also the kids who will bring their older, younger siblings, parents on the weekends after school hours to meet them here. There's pretty significant impacts on truancy rates and school attendance, also outcomes in the classroom. Health and activity levels are much higher. And what we find is that the school becomes a deeper part of the community. So these are true community centers. And we do work with the children and the larger community on the design elements of these so that it's something the community wants and values. And I will say that we have extremely low, almost negligible amounts of vandalism and other aspects because the community is really feels invested in these. You can go to the next slide, please. I do want to call out two sort of resiliency aspects of what we do. One is community resiliency, really with those participatory design elements that I talked about. We're 10 weeks in the classroom working with kids, and then we train them to present to the larger community, which includes their parents, of course, but maybe sometimes senior centers across the street that will use this park and the like. And so they do a community survey within the school and outside the school to see what design elements are needed. We do introduce them to budget realities. And so very often we have to trim back what they wanted. And it's a very educational process, and that makes the community elements of this very much stronger. And there's a lot of buy-in. From the environmental point of view, we do get funding from our water agency to manage stormwater on site. And so you can see here in this cross section, really the underpinnings of this site or drive a lot of the expense, but also drive a lot of the sort of environmental productivity of this. What we call green infrastructure does absorb stormwater, so it doesn't go into the storm system like London. It's a combined system, and we have combined sewer overflow issues. But also the trees will provide cooling and really mitigate the urban heat island effect. You can go to the next slide, please. And so here's just some shots of children enjoying, some of our sites. You can go to the next slide. Here, of course, is this is at the opening of the fitness zone. This was a January, right before COVID hit. So we, snuck it in. I will say the importance of open space is very widely recognized now. It was before COVID. During COVID, people couldn't go to movie theaters. People couldn't go to bars, restaurants. People could go to parks and open space. Visitorship at all open space was off the charts. And you can see the potential here. Behind you, that's a lot of open space for New York. Very mature, wonderful plane trees, typically London plane trees, which survive well in the urban environment. But you can also see those low fences in the background. A lot of the open space is walled off and not useful, frankly, or well used anyways. We realize that this is tremendous potential, as NYCHA did, of course, as the owner. And what we call in the park world, activation or programming is really critical. So we did work with the residents, as you saw, I hope, in the video from the wonderful president of the Residents Association, Sean Commodore, who has taken this under his wing and trains and NYCHA residents, shows them how to use the equipment, and it's really almost an unpaid monitor there, but it was well used on a January day, and we hope for more to continue. Next slide, please. Here you can see, just wanted to show this slide, how we sited it under some of those trees. So even on a super hot day, it's very hot, there's a heat wave happening and it's only June in New York City. You can use this at least in the early hours or late hours because it's covered in shade, and that's really critical to keep it useful. Next slide, please. And here it is. You can see that super block and the potential for activation of all sorts at the fitness zone is just one. But given all the NYCHA developments around the city, we see this as tremendously scalable, even in some ways more scalable than our schoolyard solution. Every neighborhood has a school, and that's why we started that initiative early on, but as you saw from Delma's presentation, every neighborhood in New York City has a NYCHA development. And what that means is to advance park equity and access to parks. We've done a nationwide survey in the US. And one of the things we're finding is not only is park access less in communities of color and low-income communities, but more important, park quality is less. And we measure that among many ways in terms of number of amenities, but also park acreage. So any little bit of open space we can activate and open to the public in a high need community is advancing equity. And we think that's critical. Next slide, please. That's it. So looking forward to the conversation, everyone.
Thank you so much. That was such an amazing, I've just got about 1,000 questions for you all, and I'm going to take my chair's privilege to ask a few and then invite the audience to come and ask their questions as well. But fantastic presentations. And Carter, your last point in particular, we actually did a seminar on a similar topic, that in London it's the same thing, where those communities that are more deprived have less access to quality green space, and then they also actually use them less as well. So it's a huge problem, but very envious that, I think, am I right in thinking from your video, 70% of NYCHA's space is open space? I mean, that's incredible. That's just that statistic alone, the amount and quantity you've got is just brilliant, and just so impressed by by the initiative and by what you're achieving. Andrea, I know you have to go slightly earlier, so I'm going to come to you for the first question, which is about these local health leaders, because I think for us, there are a couple of projects that we've come across that use local people to help promote health within their local community, and they've proved really effective. So I was wondering if you could just say a little bit more about your health leaders. How did you recruit them? How did you incentivize them? And what sort of activities do they get involved in?
Yeah, happy to do so. So yeah, we call them community health leaders. This is an emerging sort of body of workforce within the really healthcare and health system across the United States. There's lots of controversy around whether they should be certified and regulated, or is it something that should be left more open and for people to be able to access employment opportunities more freely. But we started our work with a partnership from our city's health department that focused on bringing these health workers into targeted NYCHA communities, actually in that same East Harlem neighborhood, and having them do health coaching to support the residents informing and seeking out health goals to either better manage a chronic condition or, whatever health goal the residents were identifying. And so through that, we saw that actually people came in a lot of times with the intention of hiring residents to be able to fill these jobs, but there wasn't really a structured pathway to allow that. So for the past couple of years, we focused on building a dedicated pathway for NYCHA residents into these careers and these opportunities. And we did a really exciting pilot last year with a local community college where they were doing a 3-course training program over the course of a semester. So 3 months, college courses, which were virtual because of COVID, an internship, which was sometimes blended virtual and in person, and that was a paid internship, and then job placement assistance to help the community health workers find jobs, which a number of them have found jobs that have been related to COVID recovery and promoting testing and vaccination. So we are really working with a number of partners to expand that work right now. There's actually some federal funding coming to New York, as well it should, for ongoing COVID recovery that may allow us to activate and scale this program on a much larger scale. I will say, very frankly, with regard to the Carver project, we had originally envisioned and secured some funding for something we were calling an ambassadors program, which was actually going to train residents to be like fitness ambassadors to welcome other residents into the space. I talk about partnerships. Sometimes failure is part of the path towards success. That was one that we weren't quite able to get off the ground. And I think the story was that the local community partner, which is, a local community fitness organization led by Black and Brown New Yorkers who are really seeking to address systemic and structural racism as it relates to people's access and
utilization of fitness opportunities across the city. They were just a small business and a small NGO that suffered and folded during COVID, as a lot have. So I hope that's something that we're able to pick up in the future. But sometimes we have programmatic intentions that we're not quite able to execute in the original timeline and vision, but I think we're going to keep pushing in that regard. And as we saw from Mr. Commodore, and I think Sean mentioned this, they're also just these natural health workers and ambassadors that just take local stewardship and ownership. And in the case of Carver, that's something that we really cultivated because we consistently went out to the resident meetings to speak with the residents, get their investment and ownership of this amazing project.
Okay.
Can I add on, Nicola, to Andrea's comments? I will say that one of the partners that we mentioned, but just to draw out a little bit more, is Mount Sinai, which is a hospital. And it so happened that this site, one of the reasons it was selected, it was not only the high need population, but the fact that it's across the street from a hospital. And they were a project partner. A moderate size gift to that, but part of that included a commitment, again, pre-COVID, and we have to circle back to, enlist some of their staff to help with some of the training, and like to have occupational health therapy staff and everything like that. So a partner like that is wonderful. And I will say that we have had some success on the West Coast in the US in working with health insurance companies to help fund this kind of work because of the importance of a wellness regime and outcomes, but it's not as systemic as we would like. And so I think that is one on the funding side. I see there's some chat questions about that. I think that's one opportunity for greater involvement and partnership.
Okay, thank you. And actually, I was going to come to you, Carter, for my next question. And that's been picked up by a few people in the audience. I think this sort of response to the amount of green space or open space that you have. And the Mayor of London has put forward a pledge that he wants London to be 50% green space by 2050. So, but we just don't have anywhere near the amount of space that you've got. So I'm really interested in so we're going to have to be thinking very cleverly, I think, about how we use the space that we've got and how we can create new space on roofs and all of that. So I was interested in your point about the playgrounds. And in this country, there are some amazing examples of how schools have opened their playgrounds up for the community. And I think that's a fantastic thing in bringing the community and the school together. But and also if you're working in deprived areas, bringing lots of different groups together. But then there's this sort of reaction also that the insurance won't cover it, that it will get vandalized, blah blah blah. How have you kind of addressed those worries and concerns in the projects that you've worked on? And what was it, 260 I think you've done so far or something?
214, but the city has done some on their own, so there will be in the mid 200s, and we estimate of the 1,000 schools in New York, there's about half that have the potential, have the kind of outdoor space that was designed back in the 30s and 40s and paved over since. Too often used as parking lot for school teachers, by the way. So, and that's just the way it is. And I understand that need, it's important too, but I don't think it ranks above or should rank above children's health. Operation maintenance is pretty critical, and that's part of, we bring the capital dollars and get involved on the capital side, but we don't operate and maintain. That's not our business model. And that really is the school's portion. It actually, shows the strength of this, which is that we rely very simply on school custodians to do that and get some extra funding for school custodians to open the gates, monitor the site. They appreciate it, of course, and actually are quite, productive ambassadors for our program when they switch schools or they say, like, this is a really great program. So that success begets success. In fact, in our participatory design program, we will bring the school community to a finished site so they can imagine, because renderings only go so far. And we think that's a critical aspect as well, and certainly would be one that we want to repeat in this NYCHA Fitness Zone project. So, that's really the way, I don't know if I addressed your question, but that's the way, we're structured right now. And we do think that, having that larger community buy-in is really critical, because that brings along with it, frankly, political support for what we call earmarks, which are, capital project designated by legislators. We actually have something called participatory budgeting in New York, which has gives a very limited amount of capital dollars to legislators. We have 51 council members to work with the community and get them to allocate that. And often we see public spaces rise to the top of what they want, and libraries, to be honest, which is a different indoor public space.
Okay, thanks, Carter. I'm going to come to Stephen Hill, who's a long-term friend of Future of London, is an amazing knowledge of all things housing, particularly community-led housing and co-design. So I know, and Richard and Delma both asked a similar question around this use of this amount of open space. So Stephen Hill, shall I invite you to ask your question yourself?
Okay,
if you can switch your camera
thank you very much. Hello, Delma and colleagues in New York. Lovely to hear from you. Yes, I'm a land economist, but a lot of my work has been in co-production and participatory planning, working with local authorities on the revitalization of some of their older projects. And I was really struck when you were talking about your different typologies and you were talking about the infill developments. I wasn't quite sure whether that's an ongoing program and whether when you're considering the use of all your open spaces, how you make a kind of balanced choice between new housing and other uses. And I know that in London, colleagues who've asked questions, land is so scarce, land is so expensive, it becomes an almost overriding factor to say, right, we have to build some new housing here. And that leaves out of the equation some of these other more intangible things, which are nevertheless so important. So my question was really, do you have a kind of a structured social and economic evaluation process that you use in these circumstances? And is it something that is also kind of accessible when you work with residents, so that the way you think about this thing is also something that helps you structure your discussions with residents so they can understand how the choices may ultimately have to be made?
Yeah, I'll jump in for that one. And I do want to caveat that we have a whole real estate development section at NYCHA that dives into these issues, but that's a very valid question, one that I get a lot leading an open space program here. But we do have a system for analysis, and I want to touch on your first point, which is the scattered site infill designated category that we kind of established when we talked about our building typologies. So when I mentioned infill there, it was the infill that was happening in the 80s and 90s. So it was a very specific time point. But we do have a currently ongoing infill initiative for real estate. And that one is I would say a pretty slow moving beast, because it does take a lot of community outreach and conversations with elected officials to get any new construction done on NYCHA property. So, I mean, at first it has to obviously go through the zoning that exists within New York City, but then a lot of the financing is done in partnership with other city agencies. So it goes through that process as well. Basically coming to a community planning process to build consensus on what is going to go there, whether it's a senior housing building or an affordable housing building or something that's more mixed income. And so those processes take years. We've seen, I think, only a few, and mostly senior housing be constructed like from a fully new building standpoint as of now. But those are still ongoing conversations, because like you said, there's a huge need. NYCHA has I think a less than 1% vacancy rate and a 5-year plus waiting list. So there's huge demand for affordable housing here. And of that 70%, which includes, the surface parking lots, includes anything that is not a residential housing building, even if you were to look at the by right zoning, or what is allowable by New York City zoning, there's a lot of open space where you really can't build on anyways, because of the way things are structured and how the public streets are laid out now. So I think that in a way serves to our advantage in preserving some of these green spaces for any future development as well, and being able to adequately program them, because if you do have a new construction building, which right now we're working with a partner who is building a new building, and then also how does it better connect to the outdoor space? How does it activate that street How does it bring a lot of these connections that we've been talking about, stewards, you know, all of the things that an open space by itself might not have, but a new building can provide that opportunity. So it is a delicate balance, but I think one of the benefits is that new construction moves very slowly here, because we are increasingly trying to make it a community planning process as well. So that's why the guidebook talks about community engagement as one of the focuses of NYCHA's participatory planning process. And when the real estate department also engages different resident communities, they talk about the book. We go through, you know, what are the principles? What have we learned from the past? Because it hasn't always been a great process, and there's a lot of trust that needs to be built back up.
Thank you, Delma. That's great. I'm now going to go to Stanley Lau, and then Rory, I'm going to come to you, and then Richard or James, I'll come to you. So Stanley's at the London Borough of Waltham Forest, and is also one of our Future of London alumni. So Stanley, your question.
Hi everyone. Thank you, Delma, Andrea and Carter for your presentations. That was most informative. So where I work at the London Borough of Waltham Forest, we continue to aspire through the planning process in particular to achieve 15-minute neighbourhoods and mixed and balanced communities. The 15-minute neighbourhood seeks to improve the quality of life for residents by reducing dependency on the car and promoting more sustainable modes of transportation, improving air quality and making neighbourhoods safer, inclusive, more diverse and self-sufficient by delivering social infrastructure and local amenities. The question I have is, how have you integrated health priorities at the strategy and planning stages? And how has this translated into projects on the ground? And that's the question for anyone on the panel. Thank you.
So who wants to take that one?
I mean, I'll start off. I think that, and I also saw a question in the chat about health indicators. I think that one thing I would say is that sort of what is health and what creates health is something that is very much for communities to determine or help determine or influence. So I hope it's come across, and maybe folks will also have the opportunity to look at the guidebook. You know, if we were doing this initiative 20 years ago, I think there would probably be a very different approach, talking to health experts about prescribed urban design solutions that are going to, you know, move the needle by this percentage point, you know, on diabetes, you know, new identification of disease or hospitalization or chronic disease management. I think that we are now at a place where we very much understand that these systems work more holistically, that it's really about community members helping to identify across systems what they think is going to help build healthy communities. And then, as Carter said, working with health partners, trying to get their investment and support. And maybe there are more sort of evidence-based programmatic elements that can be layered in on top of these design elements. I think that that's something that we're talking about in the case of Carver House's fitness zone. Are there also like fitness classes or walking groups that could be started there? But just to say that I think it's really important to center these in community priorities and look at the full span of indicators and data and metrics that are available to help examine impact. I don't know if anyone wants to add to that.
I'll add to it. I mean, I think as Andrea mentioned, our health department, a critical factor, and one of the questions I believe from Richard at the YMCA, great organization. We have a lot in the city, and they're an important part of our public health landscape, by the way, for those indoor spaces. Probably much like the Y, actually, where we get involved from a point of view is we do look at making sure we have coverage. 10-minute walk is, you know, one metric, easily understood. You know, the planners among us might say simplistic, but that's sometimes what you have to do to cut through the policy chatter, as you know. But within that, we get involved without a prescription necessarily, but where we focus our energy is on those areas with poor health outcomes, which, you know, track poverty, track a lot of things that are necessary. So we do rely on those public health statistics that our Department of Health collects and puts in a geospatial you know, layer on maps that we can pair with public open space. So, you know, and I think the health indicators we're looking at are really more among, and you saw them highlighted in Andrea's chart earlier, are things like obesity, those diseases that are chronic and related to, lifestyle and environment. We don't necessarily focus on our work on things like, cancer, although there'd be an argument for it, but things like asthma, obesity, diabetes, and, pre-obesity measurements that can be addressed by activity levels. I think a really interesting question, we haven't done it yet. We talk a lot about the mental health impacts and things like the Japanese concept of forest bathing and the like. We know it's critical. We don't focus our efforts based on mental health indicators. I don't think they're systematically collected here in a way that would be useful.
Yeah, I just want to add a little bit to that in the mental health component, because a lot of our projects also are centered on the social cohesion and community resilience component that Carter mentioned. And it particularly in public housing communities in New York, we're seeing a lot of exposure to violence. So we work a lot with the Mayor's Office of Criminal Justice to address the mental health impacts of that and the stress that comes with things like that, as well as the climate risk that we're facing, which is another health component. As we know, we're in the middle of this heat wave, and we see our elderly population particularly affected when things like that happen. So in trying to take this very holistic approach to what health means and what health means in specific communities, I think that's the part that becomes really important, because then you know what you're tackling, and you know how folks in that community want to measure the outcome, because it can look so different, I think, across neighborhoods.
I think that's an amazing approach to actually allow communities to decide what health means to them. I think that's a really, and I'm not sure, maybe Bav, who's on the call, might be able to help us with whether that is a common practice in this country. I don't think it is. We've got so many questions to get through, so I'm going to go to Rory from Paula Thomas Edwards Architects, one of the sponsors of the programme, and then go to you, Richard James. Rory, over to you.
Hi, Nicola. Thanks, and thanks to all our colleagues from New York for taking time to share their brilliant insight to the work that they're doing. Like the previous questioner, actually Stanley, I don't work in Waltham Forest, but I live in Waltham Forest, and I'm very lucky to live in this part of London because it is actually a forest. And I'm right next door to it. And sometimes I think it's like the 15-minute forest, because I'm walking that direction for 15 minutes and I come to a supermarket, and I walk across the forest in the other direction and I come to my daughter's school. And actually it's an issue around my daughter and actually all young girls that I have a question. The work that we do at Paula Thomas Edwards gets us involved in public housing and creation of public realm. And increasingly, one of the issues that we're dealing with is the lack of provision of public space for young girls and teenage girls in particular. And there's a campaign group actually based in London called Making Space for Girls, which is quite sort of vociferous in its criticism, basically saying that a huge amount of public provision for young people is multi-use game space, and much of this is mostly used by young males. And we're struck by the sign behind Carter when he was talking us that parks unite us, and broadly I would agree with that. But I wonder, actually, are we seeing properly united public spaces in the current climate, and are we doing enough for teenage girls?
I can address that really quickly, Nicola and Delma and whatnot. Rory, you raise a great point, and I will say that when we've assessed our activation, before and after activity levels, for the users of our school playgrounds, just one example. We haven't done it yet for Fitness Zone because there's only one in New York so far. We see the biggest jump in activity levels for girls. And in part, we have some design tricks for those architects and and engineers out there and planners that we use. One, you're absolutely right. I mean, we have you can almost see it here behind me. Yes, the turf field, but it's not marked with lines or whatnot, so it's definitely an open space, right? So it can be adaptable. A lot of true parks, meaning parks operated by the city, do have fields where you need a permit. It leads to organized sports, and it does lead to kind of disparities you're talking about. When you have an open space like this, yes, it can be a pickup game for soccer, or it can be used for gymnastics or the like. We do put in what we call little circular yoga pads, and that is often at the request of the girls, actually, who are part of our design team, or stages. Little stages. It doesn't take much. Children's imagination, or these little gazebos where we can have talk. And we also find that there's quite an overlap between some of the seniors who are around the areas and some of those sitting areas. So it's definitely something you have to pay attention to. I will say I learned a lesson from, I criticized one of our design team who was talking about how we've also put in half-court basketball courts, so it doesn't lead to older teenagers and adults taking over a full-court basketball. That's a U.S. thing, but nonetheless, one of our design team was talking about a half-court that was painted pink, and I was like, look, don't stereotype girls. Don't tell me. And they're like, actually, they asked for that because it was kind of reverse jujitsu. The boys won't play on the pink basketball court, so then the girls have it exclusively. And okay, listen to the community. Learn something new every day.
Thank you.
I was going to also just mention the basketball courts in the NYCHA context. I think that, Delma can speak to this further, but, we have playgrounds, which are also more gender neutral for younger residents. But when it comes to adult residents, basketball courts are really the dominant amenity that we have. And I think that that is the door that the fitness zone has opened up. It is very much gender neutral. When you go to visit this Carver House site, you're going to see men and women, people of various ages out there. And I think that's absolutely something that we want to pursue more. I really appreciate the question.
Yeah, I would highlight everything everybody just said is definitely true. And we most of our sports courts are basketball courts. So I think we have that issue very loud and clear and kind of at the forefront of things. And our master plan process is working against that. We're trying to reprogram spaces for women and girls, but also for kind of the teenagers that are not totally addressed in the spaces that we have now. We have 800 playgrounds, which is actually a huge number, about 40% of the playgrounds that New York City has. But so those are all really targeting ages 12 and under. So we know that the programming is really disproportionate right now. But then another thing I wanted to highlight is the programming component that we keep going back to, because I did read that programming, actually this structured organization of activity makes women and girls more comfortable in accessing these spaces and interacting in these spaces. And so that is another very important reason to have that component and those partnerships available.
Okay, thank you so much. Richard, James, coming to you, and then I'll come to Jabed Rahman for the next question. So Richard, do you want to ask your question? Welcome.
Yeah, you already answered one of my questions. It's just about health indicators. I think sort of moving on to my other question. So we've looked at the Y model in the US and particularly New York, and philanthropy is obviously a cultural thing, which is much more an American thing. So I think for us in London, there's also a challenge for us in terms of how we raise that sort of capital that sort of brings things on stream. I guess sort of linked to that then was how you continue to evolve the product. Who takes ownership? So if you're putting something in, Carter, brand new, how does that stay maintained? Who's responsible for that? Whether you're programming stuff in, how does that programming respond as communities evolve and change as well? So was that beyond the initial philanthropic investment? How does the physical site respond socially to the community?
Yeah, I mean, I guess I'll take that initially, but I think, Delma and Andrea will have something to say about it as well. I mean, what we do for schoolyards, again, that's the model here, and I keep coming back to it, even though, because it was a sort of prototype for, Fitness Zone. For schoolyards, what we do is, to be clear, the philanthropic work we do, philanthropic funding, is for, our staff time, but also our design time. And the construction dollars are almost all public, whether, we're starting to see some federal dollars maybe in state, but typically city. What that blend does actually is allow us to do for many years design build. and because we were using the private dollars for the design side. And that's kind of new authority, but it allowed us to work efficiently, bring the cost and time down to about half of what the city does for equivalent work. So that that blend is important. What we do on the public side is basically reserve some for a repair fund for those turf fields for everything else. And we're starting to see those come in. So we have just reserved capital from the outset. I think that would be an important lesson. For those sites that just wear down, we're starting to see those come around that need a wholesale redevelopment. We don't have enough reserve funds for those, so that would just be a new capital ask, to our public partners, and just another reinvestment, if that makes sense.
And I'll jump in for some of the other models that we brought up, such as the farms at NYCHA. I think that's one of our most successful models in terms of ongoing maintenance and stewardship of space, because that works with a local organization to help plant and harvest those farms. And then, I mean, they're seasonal because they're external farms, but then they're also able to make all of this produce and work with the community. So it's like a very symbiotic relationship. And I think that those are the ones that we've seen work the best, is when you have the local partner there to help steward the space. One thing I want to bring up as a challenge, because I think it's always good to talk about the gaps, is that there's not a lot of data for the New York City Housing Authority within the larger city parks context, right? Like the Parks Department has an enormous amount of data and analysis on their properties, but public housing sort of sits outside of that, even though for the typical New Yorker, a NYCHA open green space looks like a parks open green space. And so we're really working with the city agencies to try to bridge that gap in data and analysis, because I think asset management, understanding which of these park spaces haven't seen investment for 30 years and need that capital investment, is also key to the maintenance component. Because if you're trying to build back up on something that needs, that hasn't seen anything in 30 years, you're not really going to be able to make that up in the maintenance. So both of those, the ongoing stewardship and building those partnerships, but then understanding the assets that we have across the city.
Thank you. I think it's something that we sometimes struggle here, in that there's a lot of attention on nice new flashy spaces, but actually the long-term maintenance on is absolutely fundamental in so many aspects of health, aspects of community pride in a neighborhood. But it's not the kind of sexy thing, is it? It's the kind of ribbon cutting events that draw the attention, and it's often hard to think about that long-term management and maintenance. So thank you for that. I'm next going to go to Gemma Bourne. Gemma, your question for the panel, please.
Yeah, good afternoon. Thank you for a great presentation, and didn't think we'd get many field trips, so this is great, so thank you. I was thinking about reflecting on some of the health programs and wondered what kind of percentage of residents typically participate, and how much you have to encourage that participation. In a kind of previous life, I used to find, particularly in urban regen, as much as residents were involved in designing some of the programs and outcomes, actually the number and kind of almost like the penetration rate, as it were, of residents participating was really low, and it was even harder to encourage the continuous uptake. So I wonder how that was, that a parallel to what you were finding at all, and if not, what were you doing differently that we could all learn from?
So I know Andrea would have a lot to say on this, and unfortunately she had to jump off, but I can speak to that because we see the same issue. It's not uncommon for us to really try to do outreach and then have a sort of low rate of return on that. And I think we've learned tremendously from that too, about how to do outreach, particularly in public housing communities. It has morphed over the years, particularly during COVID. We started to see where it really broke down, and how do we reach our residents and have them trust the process, because I think that's how we lose people, is that we go and we try to do participatory or community planning, and then it takes a really long time, and it's more extractive of these communities and their time and efforts than it's worth it for them. So in terms of ways that we've tried to improve it, and by no means, I don't think we've gotten to the point where we want to be, but compensating people for their time and really digging into analog engagement strategies. COVID, I think, skyrocketed our abilities to do digital engagement, but that has not proven to be able to reach all of our residents. They don't all have internet, they don't all have devices or know how to adequately engage with those. And so finding creative ways to be able to do passive or analog outreach, particularly in the field, in these communities, with partner organizations that already have that trust built up, like the YMCA or the community centers. That is where we're, I think, heading towards building capacity there, and also with our resident associations, because those are the represented leaders of those communities. A development can have about 4,000 residents on the larger end, so that's a lot of residents to represent, but they're definitely our first points of contact and can tell us who the local leaders are and how to better do outreach. And then to stay consistent, we have some programs that luckily have had funding over a time span of 4 or 5 years. And we've seen those programs be more successful in being able to reach out and actually have turnout in the community. They'll have events and they'll have hundreds of people there because people have seen them in their t-shirt there every Saturday for 5 years. And I think there's nothing that compares to that.
Yeah, it's one, just to follow up on what Delma said. I mean, I think, changing the culture of the place is the most enduring, of course, but the hardest, right? And that's why we think that, post-COVID, we think this is a critical inflection place because so many people over the last 15 months use their open spaces, got used to it, maybe for the first time, built it into their daily life. And if that continues, that would be wonderful. I do see that, to, beat the drum too much, but, a big role for the health community, the health providers, because if they're right, there was a park RX movement, for example, write a prescription for using a park every day, to encourage that kind of use. That would be critical. We're not quite there yet, but that I think is a really critical piece of the puzzle for the reasons addressed in the question, which are you can build it, but you have to make sure people come.
And one last piece I want to add is in terms of accessibility to these neighborhoods too, is making things mobile. We're working with, I mentioned the Mayor's Office of Criminal Justice, and they have a mobile trauma unit now that is like essentially a bus that goes to neighborhoods and tries to work through and help with the mental health issues that come with violence and that sort of trauma on the front end, but also unfortunately after an event may happen. And so, now that we're seeing COVID buses, we're seeing buses be able to do many things. And so having that as a resource that moves between neighborhoods that are high need is also, I think, a very creative solution.
I think was it. Delma, thank you very much. I'd now like to come to Javed Rama, who is our public health healthy places lead for the Richmond and Wandsworth boroughs. So over to you, Javed, for your question to the panel.
Yeah, I have, by the way, excellent program. It's really encouraging to see what you're doing on the ground. It's very encouraging for us all. 2 questions. I think the second one you've answered to a certain extent. The first one is around partnership working. And really, how has that been sustained, and kind of what kind of difficulties or challenges have you had in that program, particularly over a long period of time? I understand, you have partnerships that can be effective in, 2 to 3 year time program, but it's more difficult sustaining that over a 4 or 5 year program, where you are actually achieving outcomes at the end of year 5, for instance, but you still need the involvement of that partnership working. The second one, I think, has been answered to a certain extent. It's all about COVID recovery and how you're getting the community involved in that process. What has been the challenges in terms of stewardship, in terms of all the kind of other issues, public health issues, operational issues that have come along with that. So those are 2 of my questions. Thank you.
Thanks for those. Those are really good questions. And I would say that the NYCHA Trust for Public Land relationship is, I think, like a key example of how difficult it can be to build the partnerships. you know, we have very aligned missions. That doesn't mean it hasn't been hard. I feel like the legal agreement, just to establish the legal agreement to build the first project, took 5 years. And yeah, I know that's like insane. But I think a measure of the progress is that we just signed another legal agreement for a different adult fitness area with another nonprofit, and that only took 3 years. So yeah, but what we're hoping is to help build these pathways for partnership and help streamline the process. And with Trust for Public Land in particular, build an MOU that really allows us to scale without the issues of a pilot project. And so I think that that's what we're seeing with many of our nonprofit partners, is that the pilot is really the painful part, but most of these pilots have been successful to an extent. And to be able to scale it is sort of the next step, and hopefully not as painful, but will allow us, because our portfolio is so large, to be able to do that work up front and then be able to see the impact pretty incrementally, I would say. And then just to talk to our other partnership types, which are our public partnerships. So there are, a lot of city agencies in New York that deal with the public realm and do capital improvements, and particularly want to invest in these neighborhoods too. And those seem to be a little bit easier because the public to public entity and the liability and insurance issues aren't there. So those, I know they're not very fun to talk about, but liability and insurance, maintenance, all of those things are key factors in building these partnerships from a legal standpoint. And so it's been a little bit easier with the city agencies, and then city agencies have these operational budgets for maintenance too. So from that point of view, it also is a little bit easier and consistent. And then there's the private relationships that we have. And I think that those really are, sometimes they have their own agenda, if it's a philanthropy or a private development team, to be innovative or to meet certain expectations of the market that they are looking for. And so we treat each of them differently, but I think we've kind of started to understand the framework that we need to make all of them move quickly, which is what we've been working on in our strategic plan, as to how to strengthen those relationships and build on that. I don't know, Carter, if you want to throw something in on the partnerships then.
No, I mean, I think the insurance piece is difficult, and there's other city agencies that have required more. I mean, in this case, look, this was new. This is a pilot. We certainly hope it's scalable. Some of the things that we worked out were, an extended warranty, which we fundraised for from the equipment manufacturer, because it's moving parts and that's new. And, we want to make sure that they can be repaired. So, this was new. There's certainly some kinks to be worked out. But as we've seen with the New York City schools, once trust builds up and once you have a longstanding relationship, quite frankly, more is delegated to an outside partner once they've established themselves, and that makes it easier for an agency to operate and focus on everything else that has to be done. When they can get a certain amount off their plate. So, I think that's cool. Just every partnership is unique, but those are some of the success factors, I would say.
And then in terms of COVID recovery, to your second question, I would say, it particularly NYCHA as a landlord, right? Like, our primary purpose is being a landlord, not a parks department, not an open space steward. Our immediate emergency response was towards cleaning and food access and distribution and PPE towards our residents. And so that was sort of front and center. Actually, a lot of our playgrounds were fenced off during the beginning of COVID, because people didn't really know what was happening, and a lot of these spaces were fenced off for cautious purposes. But then they were opened up, and so we started to see, like Carter mentioned, a dramatic increase in the usage of these spaces. And so that's one trend we saw. But then also, these organizations that had been embedded in the communities a large amount of them through participatory design processes or participatory planning, could pivot to emergency distribution of materials or services, or even in one case, letting us know, who didn't have a tablet or who didn't have connection to the authority and couldn't kind of like say what they needed. And so having those folks that we had worked with from a design and planning level being on the ground they were able to communicate with us in an emergency situation much more quickly, which was helpful. And now everybody's sort of, ramping back to the work that they've been doing. There's, in some senses, like a decreased amount of funding. I think there's like a bigger urgency for open space, a better understanding of why it's needed, but then there have also been dramatic budget cuts. So it's kind of, I think, in conflict for a lot of us who do this work and have these goals, because our case has been made, but the resources aren't necessarily following. So that has been one thing that we're planning around and trying to figure out better in COVID recovery.
Thank you so much. We're going to have to wrap it up there. I'm sorry we can't get to all of the questions, but they have been absolutely fantastic. And I feel like we've covered so much ground. Just a few of things like how we did, I think it was really interesting for me as well, how you determine health, and it's not just by the kind of the science, statistics and research, but what people think, the pressure that you have on the open spaces and how you manage the pressure to kind of build on them, the maintenance models, how to keep communities engaged, how to keep your partnerships going, and some really similar challenges, I think, to what we have in London. I would love, it'd be great if we could keep the conversation going. We're going to now close this session, but move to networking. And the whole reason for that is to put us into smaller groups. Some of our colleagues from New York are joining us on those as well, and we'd love to have you join us. But before we do that, because I know some of you won't be able to stay, I just want to say thank you so much to our sponsors. So Pollard Thomas Edwards Architects, Montague Evans and Man Tanville for making this session and the programme overall, Healthy Neighbourhoods, possible. Massive thank you to Hannah and Eunice, who are all behind the scenes making this run so smoothly. Please keep an eye out on the website for the mailing list for further events in the programme. We're hoping to have an in-person event looking at the challenge of language and terminology, sorry. But also, of course, before I leave, a huge thank you to our panel. I hope all of you have seen the video that they put together, especially for this event. It's been fantastic meeting you. I wish, as I think somebody suggested in the chat, we could meet and we could all come over and see the amazing work you're doing, but we're so grateful for your time. Thank you so much.